What's up, everybody? It's your girl Jasmine, aka the Nurse RX. This is where you can get your prescription for all things nursing related. If you're new to my channel, welcome. Hit that subscribe button wherever it is. And if you're not new to my channel, welcome back. Thanks for checking in with your girl. I finally hit over 200 subscribers. I think right now I have about 230, and I just want to say thank you so much to those of you who are subscribed to my channel. I made this channel because going to nursing school was such a long and difficult process for me, and now being in nursing school, it's like that process times two. I just wanted to make nursing school just a little bit easier, and that's my goal with this channel. So thank you so much to those of you who have subscribed and believe in my plans and my goal in this channel. So for today's video, I wanted to talk about test taking strategies. Now, what I've come to learn in nursing school: yes, you have to memorize. Yes, you have to learn. Yes, you have to apply, but part of getting an answer right is your test taking strategies that you use. So I have a bunch, I have a whole list on my computer of a bunch of strategies that I want to go over with you guys. And I have some examples that I'm pulling from this book right here, which is a fundamentals level book, Foundations, Nursing Level 1. I don't know what semester or what course you guys are currently in for nursing school, so I just wanted to start off with the basics. So a lot of these examples that I'll be pulling are very basic, but they just help you to understand the test taking strategies. So if you guys find any of these strategies helpful, go ahead and give this video a thumbs up, because that will help this video reach more people who can benefit from this information. So without further ado, let's get right into the video. So these test taking strategies are in no particular order. So tip number one, or strategy number one, is really not anything special. Read the question very carefully. I know that's like a basic, but read it very carefully. I cannot tell you how many questions I've missed just because I didn't read the end, or I didn't look for a second line of the question saying select all that apply. I just read too fast. I can't tell you how many answer options that I read too fast, and if I had just taken a few seconds to slow down and read it, I would have gotten the answer right. So always read the question very, very carefully. Now, when you are reading a question, you want to figure out what is the stem of the question. Now, what I mean by stem is, what is the question really getting at? What is the purpose of the question? What is the question really trying to ask you? Because a lot of questions will have fillers in it and extra information just to throw you off, or just to make you pick a different answer option. But you have to look at the focus of the question and what it is really asking you. Find the stem of the question. Don't be so focused on vital signs or labs or the name of a disease process and stuff like that. Find the stem of the question, because the stem of the question could have nothing to do with any of those things. The next thing you want to do is identify key words in the stem of the question. So that could include age, it could include gender, it could include the disease process, symptoms that the patient is having. And I just recommend that you guys highlight or underline those words if possible. For me, my nursing school exams are all online, not just because of the pandemic, but just in general, it's always been online. So we had a highlight feature that I could use if a question was really long or it just had a lot of things going on within the question. Another key word that you might find in the stem is the central person. There may be more than one person involved in a question in your nursing exam, and you want to focus on the central person. For example, me right now, I'm in maternal child, so we have mother baby and we have pediatrics. So a question could involve a mom and a child, but the central person, the stem, and the key word for a question could be all about the child. So you just want to make sure you understand the stem and understand the key words and key things that is going to help you find the right answer. Another thing that you want to pay attention to in the stem of the question is the time frame, because the time frame could be the difference between one answer option and another answer option. For example, if the patient is in intra-op, if they're in the actual surgery still, or are they a post-operative patient? Are the symptoms that are being presented in the question early symptoms of a disease process or late symptoms of a disease process? Because the treatment for those things could be completely different. Another thing that goes along with reading the question completely is reading the answer options, reading all of the answer options, even if you think the first answer is the right answer. Because I know I've been there. I'm reading a question really quickly. I see the answer that I'm pretty sure is the right answer, click, and I go next. And that will be the question that I get wrong. Read all of the answer options, and what you want to do ideally is start to eliminate your answer options. So I'll be going over it shortly, different strategies that I use and that are successful in eliminating answer options. But if there's any ones that you can obviously eliminate, you can go ahead and eliminate those. In my nursing program, our online test taking platform or program that we use, we can actually like exit it out where it'll draw a strike through it. If you take a paper and pen exam, strike it out, or just, don't pay attention to that answer option, because those answer options that are obviously wrong are there to just throw you off. As cruel as it sounds, it's there to throw you off. Now, I want to say one way to identify a answer option that is obviously incorrect, answer options that have the words like never, most, must, always, questions like that, they're usually wrong. I'm not going to say that they're always wrong because I don't want to be blamed for any wrong answers, but usually they're incorrect. In my experience, those always, must, never, what else is there? Every time. Those type of answer options are usually incorrect. If you can, as you take your exams, always recall previous questions, because sometimes previous questions can help you with future questions, whether it's the answer option, whether it's the way the question is asked. Always try to recall previous questions and really put your head in the game and pay attention to your exam, because there has been times, for me at least, where a previous question will have a little bit of information about a disease process just because that's how the question is formatted. So that's the question helps me recall the symptoms of a disease process or what treatment you do for a disease process, and that might help me in a future question. Now, the last random tip I want to give before I get into some strategies is your answer option that you pick for a question must 100% be correct. There should not be any way that you should be able to refute your answer. There should not be any way for your answer to be wrong. If there's a way for it to be wrong, then it is most likely not the right answer. Something that is kind of tricky with that thought process is priority questions, because usually priority questions, all the answer options could be right. It's just which one do you do first. I'll be getting into strategies for priority questions in just a little bit, but in general, your answer should be 100% right. You should not be able to refute your answer choice. And the last thing that I want to say as a random tip, go with your gut, okay? You know this material, you know how to apply material, you know how to analyze questions, you know this. Some questions, I'm not gonna lie, you just don't know the answer to. You either didn't read that part in the book, they never went over it, or what have you, you just forgot it. And when you come across that type of situation, if you have time, really spend the time and try to think your way through the question and use some of the strategies that I'm about to talk about. But at the end of the day, if nothing else works for you, you know this. So go with your gut and do not change your answer unless you can 100% justify the change, okay? Because there has been plenty of times where I've changed the answer. I have not went with my gut, and guess what? Your girl got the answer wrong. So those are like the random tips that I want to give you guys. And now I'm going to get into a few strategies for different types of questions and kind of narrowing down your answer options. All right, so the first test strategy that I want to go through is similar versus non-similar. So this is kind of known as like distractor answer options. So you want to look at all your answer options and identify if any answer options are similar to others or are they not similar to others. Most likely, if you have two answer options that are complete opposites, one of them is most likely correct. In addition, if you see two answer options that are similar, then it could be one of two things. Either one, there's a small variation in either of the answer options that leads to the correct answer, meaning one of them is correct. It's just a small, you have to just read it very carefully because there's a small difference in it that makes one of them correct. The other one is they're both not correct because they're both similar. They're both saying the same thing. So just a different variation of saying the same thing. So that's like the type of situation you can have with similar versus non-similar answer options. Another thing that you want to look for is words that are similar to the question being asked. Any words that are used in the question that are also used in the answer option can often lead you to the correct answer. I moved over a little bit so I can put the little picture here of what I'm about to read. So this is, again, from my ATI book. The question reads, a nurse is caring for a client who has a history of falls. Which of the following actions is the nurse's priority? A, complete a fall risk assessment. B, educate the client and family about fall risks. This line won't let me be great. C, eliminate safety hazards from the client's environment. Or D, make sure the client uses assistive aids in his possession. So this question is a priority question, which I'll be getting into in just a minute. But for this, we're looking at similar versus non-similar. You see here two answer options that both have the word fall. So that's a similarity between the question and the answer choices. Now, if you're looking at both of these answer options, one of them is to complete a fall risk assessment. The other one is about education. In a priority question, you have to think about, and I'll be getting into this, but you're basically thinking about what can you do if you don't do anything else, and understanding that they have a history of falls. You need to do a fall risk assessment because you need to identify if they're currently a fall risk, and if so, how likely are they to fall? Because if you don't know, you do not want a patient to fall during your shift at all. Like I said, I'm about to talk about priority questions, but before I get into priority questions, I wanted to talk about synonyms. For synonyms, what I mean by synonyms is just understanding that there's multiple words meaning the same thing in medical language. So, for example, shortness of breath. Shortness of breath can also be orthopnea. It could be tachypnic. It could be a respiratory rate above 20. It could be accessory muscles being used. It could be flared nostrils. It could be overall retractions. It could be a low O2 saturation. So just understanding the different ways something can present can help you understand a question. It can help you pick the right answer. And this is stuff that you're gonna learn while you are going through nursing school. It's not something that you need to Google or anything. You do need to Google the definitions of different words. For example, orthopnea, if you don't know what that is, that's something that you need to Google. So when it comes up in a question, you can understand what it means. And this is often learned in the first semester of nursing school. I learned it in my health assessment class, but each nursing program sets their courses up differently. So this is something that you just learn as you go on. Understand that they all mean the same thing. Reading the question, the nurse assesses a patient with chronic obstructive pulmonary disease, or COPD, who has been admitted with increasing dyspnea over the last 3 days. Which finding is most important for the nurse to report to the healthcare provider? A, respirations are 36 beats per minute. B, the anterior-posterior chest ratio is 1:1. C, lung expansion is decreased bilaterally. Or D, hyperresonance to percussion is present. So what this question is trying to ask you is, out of these 4 answer options, which one would you report to the healthcare provider, given the fact of this patient information? They have COPD and they were admitted for increased dyspnea. So you have to know, what is dyspnea? Dyspnea is a synonym for shortness of breath. It means difficulty breathing. So now looking at your answer options, you can actually do similar versus similar and synonyms at the same time. So A, respirations are 36 beats per minute. What does that mean? That means that they're having difficulty breathing. B, anterior-posterior chest ratio is 1:1. With COPD, that's expected. Lung expansion is decreased bilaterally. With COPD, that's expected. Hyperresonance to percussion is present. With COPD, that's expected. So you have 3 things that are expected and 1 thing that's not expected. Only bad thing there is respirations are 36 beats per minute. You're not gonna call a provider to tell them something good. You're gonna call the provider because something bad is happening. So that's kind of similar versus non-similar, and synonyms working at the same time to help you with this question. So the correct answer for this, which one you're going to report to a healthcare provider, is the one that is bad, which is A, respirations are 36 beats per minute, whereas B, C, and D, they're not ideal, but they're expected given the disease process. So the next strategy I want to go over is all about priority questions. Now, I have a love-hate relationship with priority questions. What bothers me is that usually for these questions, all of the answer options are correct. It's just which one are you going to do first? Now, how I see these questions usually asked is what intervention are you going to do first, or which patient will you see first? Either way, you want to approach this question like this. If I do nothing else for my shift, what would I do? If there's only one thing that I'm going to do for this entire shift, which one would it be? That's how you want to ask the question. That's how I ask the question when I go through each answer option. If you're in your first semester of nursing school, you probably have heard of Maslow's hierarchy. Definitely something that you want to instill in your brain and memorize it, because it will help you not only for your current semester, but every semester that follows, and with the NCLEX for priority questions. And if you guys don't know what Maslow's hierarchy is, I'll have a little picture here, and it basically for nurses will tell you what is the first thing that should be addressed, and so on and so forth. And I'll tell you right now, anything about education, anything about emotions, or shelter and stuff usually is not going to be the first thing you do. It all depends. For mental health, when I was in that, sometimes the shelter, emotions, those are the most important things. If the patient's not like clinically, has an infection or is in pain or has fallen or something like that. But for your med-surg classes, it's not going to be anything education, emotional, love, stuff like that. It won't be like that. It's going to be more so airway, breathing, circulation. And if you guys don't know that, those are your ABCs. Those are your first things that you're going to do. Assess the airway, assess breathing, assess circulation. So if that's an answer option in your question, then it's going to be the ABCs, and that's the order: airway, breathing, circulation. But if that's not anything in your question, nothing about the airway, breathing, or circulation, you're going to follow Maslow's hierarchy, and you're going to ask yourself, if anything, what would I do? What would be the first and only thing that I do that whole entire shift? I will say it goes least invasive to most invasive, and usually if an answer option has the word assess and there hasn't been an assessment of it in the question, then your answer choice will be assess. A lot of times the answer options for questions like this will talk about an intervention like a treatment or medication, and you know for the disease process that it's asking about that you would give this medication, but that's not the first thing you're going to do, because you would never give a medication without assessing the patient first. So just think of it like that. If anything, what would I do? What's the least invasive thing to do, but also equally the most important thing to do? I will tell you, if an answer option is telling you to call the physician, that is most likely not the right answer. You're never gonna just call the physician. You're gonna at least do an assessment, at least get vital signs, at least get your labs written down so you can report that to the physician. So let's go over this example that I have. So by the second post-operative day, a client has not achieved satisfactory pain relief, based on the evaluation, which of the following actions should the nurse take? So A, reassess the client to determine the reasons for inadequate pain relief. B, wait to see whether the pain lessens during the next 24 hours. C, change the plan of care to provide different pain relief interventions. And D, teach the client about the plan of care for managing his pain. So this is what I was talking about. I think that all of these answers are correct. And that's basically a priority question in a nutshell. All the answer options are correct. But asking myself now, and you can ask yourself this as well, if I don't do anything else this shift, what would I do? So looking at the answer options, teaching the client about the plan of care for managing his pain, that's important. See if anything else is more important. C, change the plan of care to provide different pain relief interventions. By doing that, you're gonna help the patient achieve a lower pain, a lower report of pain. So C is more important than D. So D is out the question, now we have C. So B, wait to see whether the pain lessens during the next 24 hours. Answer options like that, like you're basically just not doing anything, and that's never going to be the answer in a nursing exam ever. It's just wait and not do anything. Now C versus A. So A is reassess the client to determine the reasons for inadequate pain relief. So how would you change the plan of care for adequate pain relief if you don't know the reason for the inadequate pain relief, if you didn't assess? And like I told you guys earlier, if an answer option has the word assess and there hasn't been an assessment made in the question, which in this case the question only says that they haven't received a satisfactory pain relief. It doesn't indicate any assessment, no objective or subjective information. So with that being said, the priority for you to do is assess. So that way you can change the plan, and that way you can teach the client about the plan that you're changing, and that way you can see what happens in 24 hours. So the answer to this is A. And I hope that the different ways I explained to you guys about tackling priority questions can help you guys. Basically using Maslow's. If this was like a trauma type of question, which it's not because I just wanted to make this very simple, then you would do the ABCs. If it was which patient you would see first, that's a Maslow's hierarchy type of thing. Which patient is the most detrimental? So the last test-taking strategy that I want to talk about is the select all that apply questions. If you're anything like me, you hate select all that apply questions. I hate select all that apply questions, and that's just because it just takes such a long time to go through select all that apply questions, because literally only one answer could be correct, or all 4 or all 5 answer options could be correct. So my advice to you guys for select all that apply questions is look at each answer option as a true or false question. First, you need to identify if this answer option is even correct in what it's saying. And then after you do that, after you see if it's a true or false statement, then you need to see if it has any type of connection to the question and what the question's asking. And you know what the question is asking. Dang, I can't talk. You know what the question is asking by looking at the stem of the question, seeing your keywords, and understanding the question, which is what I went over in the beginning of this video. So look at the answer option, true or false. If it's true, does it connect? Does it answer the question? So nurses caring for a client who fell at a nursing home. The client is oriented to person, place, and time and can follow directions. Which of the following actions should the nurse take to decrease the risk of another fall? Select all that apply. Dun, dun, dun. Select all that apply. So let's just go through each answer option one by one and see if it's true or false. So, is the belt restraint on the client when he is sitting on the bedside commode? Now, is this something that you would do in regards to the situation being presented in the question? Well, in the question it says that the patient is oriented to person, place, and time and follows commands. So, you do not need to put a restraint on somebody who is oriented like that. So, A would be false. B, keep the bed in its lowest position with all side rails up. This is an answer option that you have to read very slowly because it says all side rails up. And if you haven't learned in nursing school just yet, having all the side rails up is a restraint, and that's not something that you would do to someone who's fully oriented. So B would be false. C, make sure the client's call light is within reach. Is that a true statement? Yes, you should put the client's light within reach. Now, will the client's light and reach prevent them from having another fall? Yes, it would, because if they need something, instead of getting up and getting it or something like that, they can hit their call light. So that's true. D, provide the client with non-skid footwear. Can you provide a client with non-skid footwear? Yes. Now, would it prevent a fall? Yes, because when he's up and walking, it's a non-skid footwear. So that would help him to not fall. So that would be true. Okay, so D, complete a fall risk assessment. Can you do that? Yes, it's in your scope of practice. Will it help to prevent another fall? Yes, because it will tell you how likely they are to fall and what parameters need to be put in so that way they have a decreased chance of falling. So the correct answer for this question is C, D, and E. So that's how you should go through select all that apply questions. You need to first identify if it's something that you can do, if it's something that's possible, if it's in your scope of practice, and then go back to the stem of the question and what the question's really asking you. Will it aid in preventing this? Will it aid in doing this? And that's how you answer a select all that apply question. The very last thing that I want to say about test taking strategies and just doing your best on your exams, I have a little bit of a ritual before I take my test. I literally will sit, I'll just pray. I will pray that I can recall all my information, that everyone taking the exam can recall their information, that God is just right next to me, just helping me and helping me decrease my anxiety and boost my confidence. And I pray that on every single person taking the exam. And it just always helps me to calm down, to trust myself, to trust the journey that I'm on, and have my head in the game and be present when I'm taking the exam. So I don't know if that's in your beliefs, but just sitting down and taking a few deep breaths and just having conscious thoughts about the exam and about your heart rate, that you're having palpitations or whatever, just having those few minutes to yourself where you're not just going over material right before the exam. Whatever you can do to help calm your test taking anxiety, I highly recommend that you do that, because something that can very, very easily interfere in test taking is test taking anxiety and being unsure of yourself and unsure of what you're capable of. So I hope that these test taking strategies were at least a little bit helpful for you guys. Like I said, if you find anything helpful, give it a thumbs up so more people can come across my content. And if you have other test taking strategies or tips that I did not mention, please, please, please leave a comment below, because I want to know, and I'm sure everybody else watching this video wants to know as well. So yeah, I hope you guys enjoyed the video, and I'll see you guys in the next one. Bye.